we have Dr. Rolando Herrera, who has been working on several cancers in Latin America, and we're going to ask where he see the opportunities for decreasing the cancer burden in Latin America.
Thanks, Jorge. Yeah, well, there are many opportunities because for many of the cancers that are still highly prevalent in Latin America, we have very good new tools that are available. For example, for cervical cancer, which is one of the most common, now we have a vaccine that is highly effective and safe and is being applied in most countries around the region. And also we have new screening methods, for example, the HPV test that is slowly being introduced, but it's much more effective than previous alternatives that we had, and it's probably going to introduce big changes in that sense. For breast cancer, we have the possibility of treatment. Early diagnosis and proper treatment is very promising with the new treatments that are available against this disease, and so on and so forth with many other cancers where there are big developments. But what we need is the commitment of the governments to implement the necessary programs.
So, Dr. Herrero, where do you see the major challenges in order to implement these potential projects?
Yeah, as I said, the main challenges have to do with the limited resources that we have in most of the areas, and also in many cases there is a change of medical paradigms that are necessary. I mean, there needs to be a lot of medical education because many of these concepts are very new and are not yet completely accepted by the medical community. So that tends to be also an obstacle to change the practice in a specific country.
Thank you very much, Dr. Herrero.